This is the Dr. A Explains It All podcast, a podcast about cosmetic procedures, skincare, dermatology, and everything in between. I'm board-certified dermatologist Dr. Arash Akhavan. Let's get started. But first, a quick disclaimer.
Medical disclaimer. The information provided on this podcast is for general information and educational purposes only. It is not intended as medical advice, diagnosis, or treatment, and should not be relied upon as such. Listening to this podcast does not establish a physician-patient relationship between you and the host or any contributors. If you have specific medical concerns or questions, we encourage you consult directly with a licensed healthcare provider or physician in your area. The views expressed in this podcast are solely those of the individuals and do not necessarily represent the views of any affiliated institutions or organizations. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast.
Hello and welcome to the Dr. A Explains It All podcast. I'm Dr. Arash Akhavan. I'm a board-certified dermatologist in Manhattan, New York, owner of the Dermatology and Laser Group. As this is our first podcast, I just wanted to introduce the concept to you. We're basically going to be discussing cosmetic procedures, skincare, dermatology, all with myself and a special guest on each episode. I'll be joined by members of the practice, by patients, by other colleagues that are experts, and we hope to bring you sort of honest, no fluff, no BS input on all these different topics. And for this first episode, I'll be joined by Ashley Greenstein, who is our office manager and one of the cosmetic coordinators at the Dermatology and Laser Group. She fields a lot of the questions from people like you, whether online or by telephone or email, and I think it'll be great. She'll bring in her perspective, patient perspective, and hopefully I can add my input and kind of round out the topics. We decided to start with Botox cosmetic as our first topic of discussion, just because it's the most asked about procedure. It's the most completed procedure in practices like ours, and we thought that that would be a great thing to kick us off with. We'll also discuss different TikTok and Instagram trends, as well as skincare tips and product reviews. So without further ado, let's get started.
So let's get down to it. Botox. What is it?
So very simply, Botox is an injectable medication. It's derived from botulinum toxin. It's a medication. It's injected into the muscle. And it actually gets absorbed into the nerve that's feeding that muscle. And when the nerve tries to send a signal to the muscle telling it to squeeze, some of that signal gets blocked. So the muscle can't squeeze as much as it's used to squeezing. So it's basically getting the muscle not to flex as much. And that's the way it works. So we're using it in dynamic wrinkles, like the 11s over here in this glabella area. You're squeezing that area. But when you have the Botox there, some of that signal to squeeze is blocked. And like any muscle that's not working out, like let's say every day you're using a 20-pound dumbbell to do curls for your biceps, and now you go down to a 5-pound dumbbell. You're still doing the movement ideally, and still here you want to have movement in places you're getting Botox to have a natural result, but you're not squeezing it as much. So this muscle, for that time that the Botox is active, is not developing. And we don't want these muscles to develop. These muscles are causing these wrinkles, these furrows between the eyebrows, the lines on the forehead, the lines by the eyes, and we want to relax them. So that's the way Botox works. It's a medication injected into the muscle, preventing the muscles from contracting as much.
As much.
Mm-hmm. Ideally.
Not entirely.
Ideally.
All right. I guess we touched on this a little bit, but in terms of Botox is essentially now this overarching word that we use for neurotoxins, right? So are there other brands of Botox? What's the deal with that? If you're going into a doctor and you're saying, I want Botox, are you getting branded Botox every time? Or are there some options to choose from? And, what kind of sets these different products apart from one another?
Yeah, so there are multiple brands. We use Botox to kind of just describe this whole class of medications, just the same way you use the word Kleenex to describe all facial tissues, even if it's the store brand. You call it all
As
Kleenex.
my grandma might say, a Frigidaire instead of a refrigerator.
Exactly. So there's a few different brands now. There's Dysport, there's Xeomin, there's Jeuveau, there's Daxxify, there's Botox. So there are different brands, and they all have the same active part of the molecule that does what I just explained, the relaxing of the muscle, but they have slight little adjustments in what are called accessory molecules, little extra pieces that are slightly different between them. For the most part, it doesn't really make that much of a difference. Most people could get Botox, Xeomin, Dysport have exactly the same response. There are some slight differences, just like any medication. Like if you take a cholesterol medication, you take cholesterol medication A, and you do okay with it, and you get switched by your insurance company to B, and it's not as good, even though it's in the same class. When you're talking about medications, human bodies react differently to things. So you'll have somebody come in and they'll say, nothing else works, just Xeomin works. And you'll have somebody that'll say, nothing but Botox works. So there may be some truth to that. Maybe it was their injector did something different, or is a different injector. Maybe they got more units, maybe they got less units, or maybe it's real. Maybe the medication has some difference reaction for that particular person. The only one that stands out is there's a newer one called Daxxify that came out where that accessory compound, and they added a peptide where it was designed to last longer, and it has FDA approval to last longer. And before it came out, I was a little skeptical, is this just marketing? We have found that our patients tell us it does last a little bit longer, probably like 25% longer than Botox.
And we've been hearing that it kicks in a lot faster as well.
Yes. So, typical for this class of medications, you start to see some activity in a few days, 4 or 5 days, full activity by 2 weeks. This is slightly faster. So even at 2 days, we've started to see some of the muscles reacting to Daxxify for our patients. That's what they've been telling us.
It is cool. People are loving it. In terms of Daxxify lasting 25% longer, what is the typical sort of time frame that we can expect, for Botox to last each time we get it done?
Yeah, I think reasonable is somewhere in that 3 to 4 month range. Mm-hmm. So if you want to have the same level of muscle relaxation throughout the year, most people have to do it about 3 times a year. I don't think that's necessary. I think you definitely can just do it twice a year and let your muscle come back a little bit. You don't need to be that obsessive about it. With Daxxify, I think it's closer to around 5 months, maybe plus. Some people it's been 6 months. So just a little bit longer.
Amazing. In terms of when you should get started on this, you hear young people in college saying, I'm going to start getting Botox at 19 because it's going to be preventative and I'm never going to get those lines. What's the truth here? Yeah,
I think 19 is a little crazy. I have seen that. We do get patients coming in and they say, my friend got it. They're just like 20 years old. They're on break from college and they want to start on Botox because they've heard about preventative Botox. I think that's excessive. I don't think there's one answer. I think your lines, your face, your genetics, your sun exposure, your expressiveness, all that should dictate it. I think if you were to force me to pick an age where for most patients, it's time to get started to prevent the wrinkles from really setting in, it's probably somewhere around 25, 26. But it could be more, it could be less. The signs to look for are when you're starting to see the lines, even a hint of a line at rest, that's a good time to get started. That's not too early. If you're not seeing that at all, I think you're wasting time and money.
I would agree. And what about we're getting ready to go out and halfway through the night, we go to the bathroom and our makeup is creasing on our forehead, but you don't necessarily realize that you have lines at rest. Is that a decent time to start.
Yeah, absolutely. I think that
I get
makes
that
sense.
question
Yeah,
often.
Yeah, that makes sense.
Like, I don't see the lines when I'm not wearing makeup, but I put makeup on and 2 hours in, I've got creases. So if you're thinking about it, that might be a good time to start. Baby Botox.
Yeah.
If I hear this term one more time, what the hell are people referring to when they say they only want baby Botox? And if we won't offer baby Botox, they won't, even have a conversation. What is baby Botox?
Yeah. I mean, in the end, it's marketing. So you have so many doctors, non-doctors, injecting and having little injection clinics and med spas and this and that. And unfortunately, with all these things, everybody's looking for a little marketing angle. So and with social media, things sort of explode. So you start talking baby Botox and you make a couple of videos saying you should not get Botox. It's bad when you're young. You should get baby Botox. And everybody starts talking about baby. There's obviously no such thing as baby Botox. That's just random.
It's not a different molecule. It is not a different.
If you had to define it, you'd say baby amounts of Botox, which also there's no such thing. So, you have to put in enough Botox for it to have an effect. Otherwise, you're wasting time and money. You should ideally put in enough units so that somebody doesn't have to come in every 3 weeks to get it. If I put in one little unit of Botox over there, and you think you are relaxing that muscle, maybe you are, but not for very long, maybe just a couple of weeks. So it's kind of a waste of money. In the end, you don't want to be thinking in terms of a set number of units. Everybody's face is different. Everybody's muscles are different. You could have a 25-year-old with thick muscles that require a certain number of units for their baby Botox. And you could have a 40-year-old and they have a delicate face with delicate little muscles. And we actually use less for that person, even though their lines are a little bit thicker. So it does come down to doing a tailor-made sort of approach for each patient, making sure that you're going to someone who knows what they're doing and isn't just following some sort of formula or something they learned in some weekend course, telling them to inject 5 units here, 7 units there. There is no such thing. Everybody's muscles are so different. Even just the way they're shaped, the muscles are different. In the end, somebody who wants baby Botox is probably what they're talking about is they're looking for natural Botox. And yes, all Botox should be natural looking Botox.
Yeah, but it isn't. So what's the difference between a Botox treatment that we would do here versus that real shiny, very frozen forehead that doesn't seem to move at all, which is really the only people that people really notice have Botox. So they see that shiny forehead, they say, that is what I don't want. I will never get Botox. However, the contrary, still moving, is also true. And it's way less detectable. So what would be the difference between, is it the injector? What's going on here? Why do some people have those crazy shiny foreheads and other people it's virtually, undetectable?
Well, I mean, it does come down to the injector and what it is exactly. It's probably a combination of things. So just putting in lots of Botox is a bad idea in general. So overdoing it, if you're paralyzing someone completely so that they're frozen, they are going to have that sort of glassy, thin look, atrophied look to the muscles. The other thing is more important than probably the number of units is the placement of the Botox. So like I said, there's no cookie cutter approach. I remember when I first graduated, I was working in a practice where there was a older doctor who had just started, had no training in Botox, had just wanted to get into it. And every time he was about to go do Botox, he wasn't doing much of it. He'd do a couple here or there. Every time he was going to go, he'd come and ask me to draw on a piece of paper how many units to put for the patient he was about to go see. I kept explaining to him, like, there's no such thing. I can't just tell you without seeing the patient, examining the patient, put this many number of units. Every single person's so different, but it's the placement. So somebody's frontalis muscle, this muscle over here that makes up our forehead, may go straight up. Somebody else's may go at an angle. And if if we're not taking that into account and we're paralyzing different parts of that muscle that shouldn't necessarily be weakened, they're going to have a weird look. Their eyebrows are going to move weird. Their expression's going to look weird. And not only that, we can actually, the weirdest thing is we could actually be aging them instead of being a preventative treatment, an anti-aging treatment. With poor placement, it can look very unnatural. That sucks. But we can actually, in the long term, be causing more harm than good. So we could be paralyzing muscles that would be, over time leading to a more aged appearance. And that's something that, like I said, I'm an injection trainer for Allergan. I would say the majority of people who haven't had good formal training don't know that they could actually be harming the patients in the long term.
It's definitely good to know. So if you need training, you should call it.
There's so many amazing trainers throughout the country.
Well, I have a father that flies here on a plane every 4 months because he will not let anybody touch his face except you.
Well, that's nice. But yeah, like I said, there's so many great injectors out there. Yep.
Very humble of you.
Yep.
Another interesting one that we get is, we see these Botox bars and these med spas kind of popping up everywhere. Of concept behind them. A lot of these places do. However, personally, at least, I have friends that go to these places. Maybe they don't want to pay what they think is a premium to come to somebody like you. Likely they're saving $100 in the end, but it feels like they're going to get somewhere, something that they're going somewhere a little bit cheaper. However, all of my friends that do those also say that it lasts only about a month or 2 months. So what is the difference between getting injected by a board certified dermatologist and going to somewhere like a med spa or a Botox bar where you feel like it's great for a month and then it's kind of gone? Is that the baby Botox? Like what's happening?
No, there's multiple things happening there. First of all, I don't think, you could have a great experience at a med spa or a Botox bar. You could have a great experience with a physician. You could have a horrible experience with a Botox bar. You could have a horrible experience with a physician. With most things, the more training the person has in that procedure, the more education they have and everything surrounding that procedure, chances are they're going to do it better. I'd rather the person flying my next flight to Florida is a trained pilot, ex-Air Force pilot who's had the maximum amount of training. Could somebody from flight school land it? Most likely. I'd rather it was that pilot. With a board certified plastic surgeon, a board certified dermatologist, most modern dermatologists, plastic surgeons have had formal training on all the anatomy of the area that you're treating. They've had very formal treating education on the toxins. They've had years of courses, years of experience, years of procedures. There was a vetting process that occurs that's inherent to those fields. They were at the top of their medical school class. They went through a very rigorous training period and were at the top of that. And now you're going in and you're seeing them for the Botox. The average injector at a med spa or Botox clinic has not had that. Maybe they were trained by the owner of that med spa. Maybe they went to a few weekend courses here or there. Maybe they did 20 weekend courses. They probably didn't. They probably did 3. But if they did 100, it's still nothing compared to the training that somebody who's board certified in those fields has gone through. So is there a place for that? Yes. If when I was first graduated and I was practicing in upstate New York, there were so few dermatologists that by my by my first week out of training, I had like a 3-month wait for patients to see me because there's nobody to see. So if you're in a place like that and you're desperate for Botox, there's a place for non-physicians to be doing it. Hopefully they're trained, hopefully as trained as they can be. Hopefully they have lots of experience. Hopefully they have a good reputation that you can check, and that's the best you could do. Typically a med spa will charge less if there's economic considerations. You have to do what you've got to do. If you want to get your Botox fixed, you gotta get it, so I understand it, but I think there is something to be said for expertise. I as a physician trained in everything, I can deliver a baby. I have been part of heart surgeries and colonoscopies. You don't want me delivering your baby. You don't want me doing your next colonoscopy. Could I do it? Will you probably be fine? Yes. Could you go to a med spa and get great Botox? Yes. But it's not your best choice. So, if you've got the alternative, if you have the means, then yes, you can't go wrong with going to a board certified dermatologist, board certified plastic surgeon. Obviously I'm biased. Yeah.
Well, me too. But I would say in New York, the real truth of it is you're really not saving much when you're going to a med spa versus.
And the prices have gone actually over time. They're more in line with each other. It's not like, we don't charge that much more for Botox. We don't charge that much more for laser hair removal. In some cases, we're right in line with the other people. So, to each their own. I honestly don't want to knock anybody. And there's dermatologists that are horrible at Botox and horrible at what they do. And there's med spa people that are amazing. I go out there and train at the med spas. I've seen it all. I've seen people. I'm like, ooh. That's not the best. I hope none of my friends see this person. And then I've seen people, I'm like, okay, yeah, they're fine. Yeah.
Makes sense. Yeah. In terms of getting Botox and being worried that you're going to look so different, or women don't want their husbands to know, things like that, is Botox going to really change the way that you look? Is it going to change the shape of your face? Like, what's the truth there?
It shouldn't. If it's done correctly, it shouldn't. That's more of a concern, obviously, with fillers. Mm-hmm. Sometimes you're trying to change the shape of a person's face. You're trying to make their lips bigger, trying to give them more of a cheekbone or more of a chin. With fillers, it can be a lot more obvious. Plus, there's a swelling period. So we do get that quite a bit with people saying, I don't want my significant other to know. And with filler, we say, good luck, but with Botox, you wait 15 minutes, the little bumps from the Botox go down, you should be good to go. The two sort of exceptions to that, one is masseter Botox, which is a lot of people get it in this muscle over here that's involved in chewing. People will get it because they clench in that area and it causes tension, headaches, teeth grinding, TMJ. Some people do it because they want to slim their masseter. It's a big muscle. If we weaken that muscle, you are going to get a little bit of slimming in that area. I think that's one of the things that, even if it's done perfectly, it is going to cause an element of not anti-aging, but pro-aging. So it does age you a little bit by just softening that jawline. A little bit of that sort of the volume is holding up your jawline and the skin in this area. It's one of the reasons, we can get into it in a later episode, I hate that buccal fat removal. But yeah, you just do need to realize that it is aging in that area and does change the shape of your face.
So it'll soften your jawline a little bit.
Softens it, so then the skin really isn't going to be held up by as much. Yeah, and there's ethnic preferences. So we'll have patients that maybe Korean or Chinese, and they actually, in their culture, typically prefer a slimmed jawline. So those are the people that, that's an acceptable trade-off. The fact that maybe it is a little aging in the skin in the jowl area. They like that sort of slimmed jawline look. Yeah.
Speaking of the jowls, mm-hmm. here, Botox just got FDA approved for the neck. That's not to say that people were not treating the neck for many years prior, but it is now officially FDA cleared. We're big rule followers. So we're happy about this. What does it mean? What kind of patients are going to get Botox injected into their neck?
I mean, we've been doing it for the last decade. So the primary reason is there are these vertical bands, they're called platysmal bands, and doing injections along the platysmal bands. So it's basically, you'll see people where the skin kind of sticks out over here, and injecting that relaxes this muscle that's like a sheet across the neck, and it just kind of has it settle down so you don't see those bands. And just doing it along the jawline also can define the jawline a little bit and give you a little upturn in that area, good side benefit. But yeah, with Botox, we've been using it off label for years. Even what I just mentioned, that TMJ, not FDA approved, but something we commonly do. I think if you're doing it when you've been well trained on it, you understand the risks and consequences of all of that. A lot of that stuff we can use off label safely.
Nice. All right.
But yeah, that is actually hot off the presses. I mean, I think it's like it got approved like a week or a week ago, maybe.
Something like that. It's just hitting TikTok.
As of yesterday. Okay. Oh, there you go.
So I see it everywhere.
Okay.
I feel like we pretty much got to the basics of Botox.
Yeah, there's so much to discuss with Botox. I mean, we could literally talk about it for hours, and I'm sure we'll do other episodes on Botox.
I have so many questions, lip flips, these people who are taping their face at night instead of getting Botox isn't working, these Botox in a bottles, like we'll get to all of that at some point. But pivoting here a little bit, I want to talk about something else that I'm seeing on social media. Can you tell I'm addicted to TikTok? The Salmon Sperm facial.
Yeah.
What's going on?
Yeah, we've been getting lots of, again, just social media, like you said. We do get lots of patients asking about that, I think, over the last month. I don't really have mixed feelings with. I would say if this were a take it or leave it question, I'd say leave it. That's all it is. It's really just a social media trend. So there's claims that the salmon sperm has nucleotides, like little RNA and DNA fragments, that when they're injected, all sorts of things, great things happen. You generates collagen and tightens pores. There's no such thing as tightening pores, tightens pores, and all these things. I have a couple of issues with it. Primarily, who got the salmon sperm? Where is it coming from? There's no FDA clearance for it. There's no U.S. companies, unless you're, collecting that sperm yourself, which, you don't know what the source is. It's not something that's regulated. So and it's being injected into your skin, not only your skin, your face skin. Like, no thanks. I would rather not. The other thing is, what are all the other ingredients that they've mixed in with that salmon sperm? I saw like one of the leading brands, one of its main ingredients is hyaluronic acid. And then patients are saying it's hydrating, giving them a glow and plumping them up. Well, you're just doing some sort of weird hyaluronic acid, unregulated, not to be injected into the face, and now you're injecting into your face. Just if you want to do that, just get a little filler or get a little skin weave or something like that. Something that's FDA cleared for that purpose and is sterile and clean and made for that purpose. There's a lot of trends, and hopefully we'll discuss them in coming episodes, that are harmless, and if it's fun, do it, and no big deal. Then there's some that are potentially not safe. This would be one that I would say don't even do it for fun. There are better things that can generate collagen. There's better things that can hydrate you. There's better things for rejuvenation that are also FDA cleared and made in our country and safe. Leave it.
Leave it. It's a leave it. So that is our social media sort of discussion of the day.
Yeah, and I think those things are good to discuss. Yeah,
for sure.
Yeah,
I mean
so
a lot of stuff that you'll hear on TikTok is just positives about it. Nobody's really getting down into the nitty gritty of what this stuff is.
I mean, I've been seeing now this interesting thing where something will come up in TikTok, everybody's positive on it. Then I'm like, just wait. And then like 6 months later, everybody's negative. It ruined my face. It melted my fat. Blah, blah, blah. I don't want to discuss the specifics of what devices I'm talking about, but there was this device that was all the rage because the Kardashians did this, that, and everybody was doing it. And my patients would ask, and I'd be like, nope. And maybe we'll get into another episode, but I don't know. I don't know about the legality of it. Let's hold on.
We'll get into it. We just maybe won't say the name.
And then they, now everybody's talking, all the posts about this thing, whenever you see this hashtag or mention of this one device, it's always melted my face, melted my fat. And I was like, see, I told you.
Yeah. Especially for younger patients who really, you want to keep that healthy facial fat as we age, and introducing something like that to kill it is not great. Next topic would be our at-home hero product of the week. This is a new one. It was just dropped off to us a few weeks ago, and I've been using it ever since. It is the CeraVe Oil Control Moisturizing Face Gel.
Yes, you were kind enough to drop one off for me. I used it for a couple of weeks, and what do you think? You can go first. Obsessed. Yeah.
For someone who at the end of the day is just like feeling so oily, we're running around a lot here. We're touching our face. We're explaining things to people. And by the end of the day, every day, I am so oily. There's just no ifs, ands, or buts around it. With this moisturizer, I kid you not, no oil. But I'm not dry. I'm not dry whatsoever. I'm moisturized. I'm smooth. I feel hydrated, but I'm not shiny, and I'm not slick to the forehead. Okay. And it's amazing. And when I say I've now started using this as my makeup prep, this is now my skin prep. Your makeup doesn't get that shiny, crazy hue after wearing it for a few hours. It actually stays on so nicely. It's got like a little bit of a grip. And I'm pretty much obsessed with it. I know it just came out. I'm not sure if it's on shelves yet, but it should be relatively soon if it isn't yet. And
I didn't realize it was that new.
I think it is brand new, and it's amazing.
So full disclosure, we want to be honest about everything we talk about. I like it, not obsessed. I thought it was okay. It just kind of shows different things work for different people and different skin types. I think I'm probably just too oily. I'm like an oil slick. And I found it helped for an hour or two. And then I just want to wash it off because my oil was mixing with the moisturizer. So, everybody's always looking for that miracle oil control. I haven't found it yet. There's I'm so bad
the
with,
La Roche-Posay
there's matte. A La Roche-Posay, like matte, I don't know the name, but something matte. Somebody dropped off for me that I do use. I'll get the name for that and maybe we'll discuss it on another episode. But as far as the CeraVe product you mentioned, it was good. It was fine. It was a moisturizer I could definitely see myself using. Did not give me the amount of oil control. You'd kind of really hyped it up. I was so excited to use it.
Sorry, I'm going to do better next week.
No, this is good. This is good. We should
love this product.
We should kind of look at both sides of everything.
Definitely just goes to show like what works for your best friend is not going to work for you. This is a huge thing on all social media is, the perfect skincare routine and influencers saying you need to use these 3 products and your skin is going to be amazing. And guess what? For 90% of other people, that just doesn't happen. And so it really is, it's so subjective, and it so comes down to your skin and what your skin likes. My skin likes CeraVe oil control. Okay.
There you go. Yeah.
But maybe yours won't. You should try.
I'll leave it at that.
Yeah. And I feel like that's it.
Yeah,
it's sort of everything that we wanted to talk about today.
Yeah.
I do have one last thing.
Yeah.
Barbie Botox, just to kind of bring it back real quick, because that was huge. Barbie movie came out, and I kid you not, beginning the next day, we had 30 reach outs a day to our office wanting to come in for Barbie Botox. So can you just quickly explain what it is?
Yeah, I mean, that was just sort of like clever rebranding of something we'd been doing for a while, trapezius Botox. So there you have these muscles over here on top of your shoulder towards the back, and they can get overdeveloped in some people, especially people with like desk jobs and things like that, because we're holding that area under tension. Some people overuse them in their gym, like misuse them almost. And it can be a source of neck tension for a lot of people, and that's a reason why people relax the muscle with the trap Botox. But the Barbie Botox angle of it is, if you can get this muscle to shrink down a little bit, it creates more of an angle between your neck and your shoulder, so it gives you the illusion of elongating your neck.
Makes sense.
It works. It's effective both cosmetically and for symptom relief, and a lot of people love both of those benefits. It's just another use. It requires more units than we use in the facial muscles. These are much bigger muscles, but it works, and people like it.
Love it. Yeah, it's been huge.
I think that's good, right?
I think that's it.
So the one thing I wanted to kind of reach out and ask is, if you have any questions or anything, our email address and ways to contact us will be listed at the end of the podcast. Please reach out with things you'd like us to discuss, and we'll definitely incorporate those into future episodes as well.
Yeah, absolutely.
All right.
Looking forward to next week.
Sounds good. All right.
I'll get a better product. Promise.
Okay.
Thank you so much for tuning in today. If you enjoyed this episode, please make sure to subscribe to Dr. A Explains It All on your favorite podcast platform. By subscribing, you'll never miss an episode, and you'll be the first to hear about our latest discussions on skincare, cosmetic procedures, and more. And if you found this content helpful, we'd love for you to leave a rating or review. It really helps us reach more listeners like you. To learn more about our podcast or to send us questions you would like answered on here, please visit our website at drapodcast.com. That's drapodcast.com. To see us as a patient at our New York clinic, visit us at dermatologist-approved.com.